Hi everyone, so today we'll be going over our Sunday cancer screening clinic protocol. So we'll be going over clinic flow and how it compares to Saturday clinics, as well as our cancer screening requirements and how to handle each of the labs and the forms. Okay, so first we'll be going over the differences between Saturday and Sunday clinic. So on Sundays, we require all of our patients to have an appointment. So patients must be seen first on our primary care clinics on Saturdays and then have an appointment on Sundays. You as the PA will not be the ones cleaning the room. Immediately after you're done with the room, inform the floater and they'll be the ones cleaning and restocking the rooms, as well as please note that the charts will go to lab logout at the end of the day instead of the receptionist. Although you, as the PA, will not need to set up or clean up the room, it's important that you familiarize yourself with what goes in each room for Sunday clinic. So make sure you have gloves of all sizes in the room. There's extra tissues available for patients to clean up after themselves after the exams. Make sure that there's a lamp on the right side of the preceptor or MS who's performing the exam, and the trash can is placed on the left. Make sure that the tray is also at an appropriate height for the MS or MD. Additionally, you should also know that each room should have a drape and gown that will be placed on the bed. If you seem to be missing one, additional ones can be found in the bed. As for the tray setup, it should contain lubricant, speculum. If you need additional sizes, there are more located in the drawers of the bed, as well as a Cytobrush spatula, 2 cotton swabs, one big one and a small one, a male and female GC kit, pap smear container, biohazard bag, and tissues. Please note that the male and female GC kit, as well as the pap smear container, could be expired, so make sure you check those expiration dates. So it's important to memorize what cancer screenings each patient is eligible for. So for our male patients, we screen them for prostate cancer. So that is done with a prostate-specific antigen blood test and a digital rectal exam. This is a physical exam, and it's done for males ages 50 plus every 2 years. And for females, we have breast cancer screening as well as cervical cancer screenings. So for the clinical breast exam, that is done within our clinic, and it's done for ages 40 plus every 2 years. The same age requirement and frequency is done for the mammograms. However, this is a service that we do not offer in our clinic, so please go see a women's health coachee to help our patients schedule their appointment. And then for cervical cancer, there's 2 nuances to this. So for pap smears only, the requirement for that is for patients ages 21 or sexually active. So whichever one comes first to 29, and that's done every 3 years. And then pap and HPV co-testing is done for patients ages 30 to 65 every 5 years if they're in a monogamous relationship and the last result was negative. So in addition to cancer screenings, we also do STI screenings for our patients on Sundays. One of the tests we do is a gonorrhea and chlamydia test. This test will vary for your patients depending on their sex. So if they're a male patient, they'll have a male GC kit, which contains a pipette as pictured on the top left. Remember that you'll grab a urine cup because this is a urine test. So you'll have the male patient go to the bathroom and urinate into the cup, first catch or clean catch, depending on what the preceptor wants. And then you're gonna take the pipette at the sink and pipette the urine and into the tube between that urine fill line that is indicated on the tube. As for the female GC kit, it will contain 2 swabs, and the swab is used to obtain the specimen from the patient's cervix. Once the MS or MD is done with collecting that sample, you as the PA will have both hands gloved, and you'll take the swab and open the tube, and you're going to break the swab at that perforated black line. The bottom half of the swabs will go into the tube, and then the top half can be disposed in the biohazard container. So we'll also be going over the illuminated speculum protocol, which will be used for pelvic exams because oftentimes the lamp is not enough light for the MS or MD to do the pelvic exam. So after the MS leaves and before the MD comes into the room, you want to start cleaning the exterior of the battery. It'll be located at the station as shown in the picture on the right. With both hands gloved, use the 70% isopropyl alcohol wipe to clean the battery's exterior, and then allow the battery to air dry on a paper towel on the tray. After the exam, the preceptor will remove the speculum, slide the battery out, and give it to you as the PA. With both hands gloved again, perform the cleaning process above. So use the 70% isopropyl alcohol wipe and wipe the battery's exterior, leaving it on a sheet of paper towel on the tray to air dry. When the battery is completely dry, you can place it back into the station. So when handling a pap smear or pap and HPV, please remember to check the expiration date on the pap container. It is also important to note that the pap smear and HPV co-testing comes from one container. So if you're asked by the MS or MD to stir the sample in the container, make sure you have both hands gloved and take the spatula and Cytos brush and swirl it vigorously after collection. Once you're done with that, make sure you close the container properly and dispose of the Cyto brush and spatula in the trash can. So here we have a demonstration video of how to handle the pap smear and how to swirl vigorously and dispose of the Cyto brush and spatula. So here we have a demonstration video of how to handle the pap smear and how to swirl vigorously. So now we'll be going over how to fill out the forms for your pap smear and HPV co-testing. So if you have a pap smear only, you will only have the form located on the left-hand side. Make sure on that form you'll be checking cervical, Cyto brush, and spatula. And then if you have pap smear and HPV co-testing, you'll need an additional general lab form, and in the additional test and comment box, you're going to write HPV in all caps. Please note that the PAP and HPV co-testing comes from one container, so you'll have one pap smear in one biohazard bag and then 2 forms if you have co-testing. If you only have a pap smear done, you only need the pap smear form located on that left-hand side right there. Also, please note that the pap smear will always be bagged on its own. If you have any additional questions, please reach out to your respective admins, and thank you for listening, and we'll see you on Sunday.